When someone does get their first hearing aid, what can they expect from that?
Okay.
In terms of in terms of their experience, how it's going to feel, or anything else that you can add to that.
So it's a very personal experience for everyone because it's
Mm-hmm.
different for everyone. Some people take to the hearing aid like no problem. You put it in there, oh, I can hear, cool, bye doctor, and like you never see them again, and it's totally fine. Whereas other people, they struggle. It's uncomfortable, it's too loud, then it's too soft, then it's whistling, I'm having problems.
Mm-hmm.
So I think going into it, you need to just keep an open mind and know that anything's possible, and just try and manage your expectations, because
Mm-hmm.
again, it's not a miracle device, but it is a very helpful device. So
Gotcha.
generally what I found with the people who I fitted is at first they're not entirely comfortable with actually having the hearing aid on,
Mm-hmm.
to have that sort of foreign
Mm-hmm.
feeling of something in your ear. It takes a bit of getting used to,
Yeah.
but once they get used to that, then they don't really notice it much at all. Some people also struggle with the increased volume, especially
Mm-hmm.
those who have waited
Mm-hmm.
too long to get the hearing aid, because suddenly it seems overwhelming. And we
Gotcha. Too
program the
loud.
hearing aid exactly and we program the hearing aid for their hearing loss, so I know that they're hearing what they're meant to be hearing. But because they've been deprived of those sounds for so long, it's actually just like a big boom in their head, and they
Yeah.
actually
Yeah.
can't even think. So sometimes with those patients, we actually have to book several appointments so that I can slowly sort of increase the volume. So I
Gotcha.
think your everyday person can probably expect to maybe be a bit overwhelmed by sound at first,
Mm-hmm.
but to know that if you persevere and you wear that hearing aid, within at least 2 weeks, you'll start to acclimatize and feel much better with it. You might even find, especially if you're someone who has tinnitus or that ringing in the ear, when you wear your hearing aid, it's actually going to help make that sound go away, because it
Okay.
masks that sound. When you've got a louder volume going in, the tinnitus sound kind of dies into the background and you hear the better
Not
sound. So
noticeable anymore.
so as an aside, we sometimes actually prescribe hearing aids to people who don't even have a hearing loss, but they've got very bad tinnitus,
Yeah.
because the masking effect is so successful that they really, really benefit from that. So I think the best thing people can do is obviously speak to the audiologist or doctor or the person they're buying the hearing aid from, and ask what they can expect, because it's also dependent on the type and severity of their hearing
Of
loss.
course.
And their own experience. Like I said, if someone if they've got a profound hearing loss and they've been putting off getting hearing aids, they're not going to find it easy at first to adjust, but they
Yeah.
just need to persevere. Whereas someone who's got a milder hearing loss and they've caught it soon, they put the hearing aid in, they'll probably easy A4 away, happy to go.
Gotcha. Totally different experience. From our point of view, a lot of our customers do tell us that it takes a little bit of time for them to adjust to them. Maybe they have to try the different size domes. Maybe they have to try, sometimes they change even their hearing aid style. They buy it behind the ear versus in the canal. But we do have some customers that message us back and they're like, the moment I put it on, it was amazing.